Hi, I'm Annie Kenton. I'm the Equality, Diversity and Inclusion Engagement Coordinator for CFT. We expect all of our staff to meet their duties under the Armed Forces Covenant to record the status of our patients and whether they're a member of the Armed Forces community. So that would be anyone who served in the forces for a day or more, or is a spouse or a dependent of someone who's done that. And the reason that's important is because we know that there are inequalities around health access to people who've come out of the forces or to their families, because they're quite often redeployed or moved around the country, and so potentially would have to start at the bottom of waiting lists. So for our patients, it's incredibly important that we get that information. And we think that it's incredibly important to us as a trust based in Cornwall. We know that there are about 40% of the population have some link to the Armed Forces community. So without recording this information, we'd be missing a lot of people and how we can help them and support them best and provide them with the best care. So we needed to show that our staff had been made aware of their duties. So our staff are asked to complete the online e-training module around NHS healthcare for the armed forces. That we also need to make sure that whenever they register a patient on our systems, that they're asking the question, have you or a member of your family ever served in the armed forces? Then they can then put a marker on their records, and that allows them, people who are working with them, to help them to access additional support from outside organisations and charities. And we've got some really great cases where that has made a huge difference to someone's journey through our care, to be able to then receive additional support to ensure that they don't need to be readmitted, or that they're able to be discharged more quickly. Other things that we would need to do as a Veterans Aware charity, we raise awareness a lot. We have leaflets around additional support that people can get hold of, and any of our sites where we know that our staff are really on this and have been really proactive, we've been providing them with a Veterans Aware plaque to display proudly outside their site, which also helps signpost to patients who are entering the buildings to say, actually, ask about this, ask about your veteran status, ask what that means, and that can help, because obviously communication is always a two-way process, so the patients also being proactive as well can really help with that. So the whole of our trust is a Veterans Aware trust. That means every single one of our sites is expected to carry out its duties and to record patients' data and status in that way and signpost them. However, we know that we've got over 100 different sites, and it would be a very ambitious statement so we get that absolutely right every single time for every single patient across all of those sites. But what we have done is we've recognised 7 sites where we know that's happening really well. We've got really proactive staff. We've got service champions who are engaging with the rest of their staff teams to make sure that happens. And they have all been awarded their own plaques or are in the process of getting their own plaques with a special ceremony, just to celebrate that actually these staff are going above and beyond and being incredibly supportive of the Armed Forces community.